It is now a little bit past 7. The meeting was called for 7 o'clock. We are meeting at the Nashua Department of Public Health in person because the governor released the mandate to stay at home or stay away in meetings. So we had to call this, and we're here. I am Tony Soros, Dr. Tony Soros. I'm the chair of the board. With me,
Dr. Stephanie Wolf Rosenblum, a board member.
okay. We will kind of discuss what changes have happened in the last few days, and also leading up to it the last few weeks. And we're trying to be responsive to these changes and set in plan, we hope. My hope is we go to bed tonight and everything disappears, but we know that's probably not going to happen. So we have to decide, what's the best for the citizens and go in that direction. With me here is Alderman Lee, Bobby Bagley, who is the director of Environment, and Ren in the background, our IT guy, but he's also really good with what he does in support here at Place and Environmental Health. So, Bobby, would you like to start things off? Or, oh, I'm sorry.
I'm here by myself.
Oh, okay. Well, I'm sorry. I'm sorry. I wouldn't know. I apologize. Okay. We'll just call you Hey You. All right. So, Bobby, would you want to fill people in and get us going?
Great. And so, are you able to hear me? Good evening, everyone. All right, good evening, everyone. I'm Bobby Bagley, the Director for the Division of Public Health and Community Services. And what I'm going to do is share some data, some statistical data of the current situation with COVID. I'm going to give an update that includes global numbers as well as national numbers, and then numbers that allow for us to see what is happening right now in the state of New Hampshire. So for right now, in New Hampshire, we currently have 232 cases for today. We've had an average of 142 cases per day for the past 7-day period between the month of July 30th and August 5th. We have had a 101% increase compared to the previous 7-day period. We're currently at 505,000 total cases in the state of New Hampshire, with 1,061 active cases. We have currently 35 individuals that are hospitalized, and there have been a total of 1,389 total deaths in our state. As far as vaccinations, 53.7% have been fully vaccinated, and 58.5% have received at least one dose. Our test percent positivity rate right now for the state of New Hampshire is at 4.1, and that's on an average of 3,663 average tests daily. In Nashua, we currently have 100.4 per 100,000 cases that have been identified. We have a 7-day test positivity rate, which is at 4.3%. And new cases over the last 14 days, 90. We have a total number of active cases that's at 60. And we've had a total of 8,273 cases for Nashua, with 184 hospitalized and a total of 96 deaths. Compare our data to Manchester and some of the other surrounding towns. So Manchester's had 117.3 per 100,000, with a test positivity rate of 5.2. They had 131 new cases, and they have 84 active cases as of today. And then when we look at the rest of Hillsborough County, 95 per 100,000 is the new case rate, with a test positivity rate of 4.8%. And over the past 14 days, there have been 205 new cases, with a total active number of 162. So when we look at this, this data, right now in the state of New Hampshire, we are in most of our counties at substantial spread, with only 2 places showing moderate spread. And so that takes us into a measure or metric that warrants us to take some measures to make sure that we can stop and slow down the spread of this infection. Some other information that's important for us to know about is that when we think of what's happening globally in the US, there's been 35,392,660 cases, with 615,144 deaths reported as of today. The United States is first globally as far as the number of cases and deaths, followed by India, and then followed by Brazil. Worldwide, there have been over 200,670,720 cases, with over 4,263,828 deaths. And what we're seeing right now is that the most amount of cases that we're now seeing are a result of the Delta variant, which globally and nationally is representing 83% of the new cases that are being reported. And we also are seeing the variants in our state as well, with the Delta variant representing about 45% of the new cases that are being reported. At the state of New Hampshire right now, when positive tests come in, they're testing about 83 to 85% of those tests, specimens sequenced for the Delta variant. And during the week of July 22nd through August 4th, that's what we're seeing. And in the last week, it's been between 66 to 65% of those cases. Other important information that we wanted the public to be aware of, is the fact that, when we look at, what's happening, we have had such an increase in cases over the past couple of months. Again, with the Delta variant leading the number of cases that are being reported, it's really important for us to go back to looking at mitigative measures that will help slow the spread of this viral infection with masking, vaccinations. We've always believed that, the vaccinations will be key to this. And so we really want to push vaccinations and get that rate up. We also want to make sure that at this point in time, folks also wear their masks to prevent the spread of infection, vaccinated or unvaccinated. And we'll talk a little bit more about that this evening, because that'll be a big part of this discussion that we're having. Currently in Nashua, our vaccination rate of those being fully vaccinated is at 51%. So there's quite a bit more work that needs to be done. Sirs?
Thank you very much. So as you, Bobby, who did I say? Stephanie. Thank you both. As you can see, the numbers are rising. The big thing that was on most of our minds was the breakthrough event that happened in Massachusetts, and those people leaving and going back home and being the seed of infecting other people. Obviously, we all believe in vaccinations to help curb. We've come a long way. I think we still have a long way to go. I talk to younger people all the time who don't want to get vaccinated, and I'm not sure. I think it's just the aura of youth. We're immortal. Nothing's going to happen to us. And I talk to them about some of the prolonged effects that can happen to systems in their body after they've gone through COVID. And we don't want that for anybody. But right now, we're really looking at what do we do? We know it's here. Do we want to go through what we did in COVID Part 1 last year leading up to March? I am not into mandates or anything like that, but I think our first step should be a very good public effort for communication. And that relies on the Department of Public Health. That's the bag. They do it really, really, really well, and that's important. I think one of the things you have to understand is you can get the virus even though you've been vaccinated. And albeit it may not be a full-blown knock me on the butt kind of case, it's still not going to be fun to go through. So there's other things that you can do. And I think you all know them. Use masks when you're in crowded places, social distancing, try to stay away from people that you know that might be sick, even if it might be the flu, but you don't know it at the time. So you just have to play defensive. Hopefully that will help us get these numbers back down, and then we can kind of go from there. If you remember way back when we removed the mask, I said the thing that worried me the most from my research and what I was looking at was the variants, because we didn't know. We didn't know whether the vaccines would cover us, whether we would need boosters. A lot of that we still don't know altogether. We're learning, writing the manual as we go forward. So instead of monopolizing the time here, I'd like to have Dr. Stephanie, please bail me out.
Good evening. Thank you so much for caring enough to attend this evening's meeting. It is critical that we serve the citizens of Nashua by providing reliable information. And this has been a journey where we have had a marked improvement and change in the information that over the course of the year. And whenever there is a substantial change in the risk in the community, it's incumbent upon us to provide an update in information and to provide updated messaging. So are we okay, Ren? You're going to hit the record button. Moment, please. Can everybody hear? Those of you who are on video, can you wave that you can hear me okay? I'll turn off.
I can hear
Recording
you.
in progress.
Okay. So what you heard from Director Bagley is there has been a substantial uptick. There also are some known outbreaks in the community. And we don't know the downstream of that yet. We don't know how many people from the outbreak will infect others and whether those others will infect others. So we want to provide reliable information about what people can do to decrease their risk. Not only is there an uptick in the community, not only do we have vaccination rates that do not provide us with the kind of group immunity, some have called it herd immunity, that would help to lower the rate. But it is now clear that the Delta variant replicates very fast and that people who have received the Delta variant of the COVID-19, even if they are not symptomatic, have up to 1,000 times more viral particles in their breath than we saw with the original variants or even the Alpha variant or the variants we've heard of coming from different parts of the world. And now emerging is a Lambda variant, which may be even more infectious than the Delta variant. We thought at one point the vaccines would prevent, if you were fully vaccinated, meaning one dose of the Johnson & Johnson vaccine plus 2 weeks, or 2 doses of the Pfizer or the Moderna plus 2 weeks, that you couldn't pass it along to others and that you would not get sick. That the chance of being hospitalized or death was infinitesimally small and confined to persons that were immunocompromised. Because the Delta variant is a game changer, that is no longer true. So we have to think about the Swiss cheese model of how we address it. We talk a lot of biology in the Board of Health, but I will use an analogy of what we do for traffic safety. We have a seatbelt law. We expect seatbelts to save lives. We don't expect them to save every life, and we don't just rely on seatbelts. We have speed limits, we have stop signs, we have airbags, and what we are learning about these viruses is that we need to have more than one approach. There is no question that the vaccines make a huge difference in your risk of becoming, a person's risk of becoming ill, a person's risk of passing it on, a person's risk of being hospitalized or dying, a person's risk of infecting those that in those vulnerable persons in our community and in our households and in our neighborhoods that are unable to be vaccinated, like our children and like people with immunocompromise, cancer or chemotherapy and so forth. No, it's not the only thing we can do, but it's very important. And it's not new to the COVID virus. We have, in our children, we immunize them for measles, mumps, and rubella. When my grandson was born, I took a diphtheria shot because they don't give them to newborns. So we've always had a public health approach to infection where we have used vaccines as one method of limiting, reducing, not perfect, not eliminating. Masks are another thing. Masks work. Do they prevent every virus particle from exiting my breath? Well, if this was completely plastered against my face, I probably couldn't breathe. But the majority of virus particles that I, heaven forbid, should be putting into the atmosphere would be diminished. And breathing in those particles, they get stuck on the mask, they're filtered by the mask. Is that enough? No. So we have vaccines, we have social distancing, we have hand washing, we have many different methods that we use. There are some of the interesting things that are new that we didn't know a year ago when we talked about what should we do, and that was before the vaccines were even approved for emergency use, was we did not know about the long haul COVID symptoms. People are presenting with stroke and heart attacks and heart inflammation and many other organ system illnesses, even if they were not aware that they had COVID, or even if they had asymptomatic COVID. That is unquestionable. So to those young persons who, have said, okay, so if I get a mild virus, it's, I get the flu, I get a cold. Our concern is, what are the long-term effects of this virus, which is unlike any other we've dealt with. So these are the reasons that we want to provide some messaging to the community. We want the community to have enough information so that they can make their choices. There will be places, I don't know what's going to happen at the Board of Aldermen. I don't know what's going to happen with the state. I don't know what's going to happen with the CDC. But I do know that there are certain places where we already are required mask mandates, public transportation and airports and this building. And whether that will increase or not, I don't know. But our responsibility to the community, since we don't make rules or laws, we can only recommend, is that we want to provide reliable information and updated information. Sorry, my mask is slipping on the food. Readjust. And then, since I touched my mask where the virus particles probably fell, I have my little Purell with me, and I'll just do this in case I hand the paper to Dr. Storrs. Anyway, so with that, I would like to turn it back to our chair, Dr. Storrs. And I'd like to hear from the community, what are the kinds of questions that they have that will help us craft the messaging that we would like to send out tomorrow in light of this, enhanced information, in light of the CDC's new recommendation that even vaccinated persons wear masks indoors, as I am now doing, as Dr. Storrs is doing, because we're huddled onto your camera here and we're less than 3 feet apart, because we want to be a resource to you, and we want to hear the kinds of things that would help you to make your own decisions, that would help you to help others that are near and dear to you to make their decisions, and for those of you that run businesses, for you to make decisions about your businesses. So thank you very much for listening.
I would kind of scoping out the people here, and I see some familiar faces that I know, and they know me, and they would know that I love this community. I really want everybody to have the best that life has to offer to them. I want you to understand, as far as I'm concerned, there's no power struggle here or any of that kind of stuff. I want everybody to grow to their potential and live long, healthy lives. So we need to do things that sometimes have to help us to get there. One of the greatest things when the mask came off, and it looks like we looked at the tunnel and there was the light and we were near the end, and we didn't get cocky, but we felt pretty good. We felt that we were not going to be coming down with this disease. And then the proverbial light, as we all know, was the variant. And I just want you to understand, we want to craft things that are, one, doable, okay, that you can do, that make sense, that are common sense, allow us to move forward as a community. I think it hurts me every time I see somebody dying and thinking, could we have prevented that in some way? I don't know. But now, with the breakthrough of the variant being able to infect us that did get vaccinated, that scared me. So saying that, saying that, what I'd like to do is I don't want to monopolize. I'd like to have people call in and feel free to talk openly, and we'll try to answer every one of your questions. Make sure that you're satisfied with that we gave you a thorough and accurate answer to the best that we can. A few months ago, we couldn't. We thought we were, but things changed. Okay, so what I'm going to do is I'm going to open it up to the public. We have one on the floor first, who was raising her hand. I am going to limit it to 3 minutes because this may end up being a 16-hour meeting, and I don't think anybody wants to hear me talk for that long. So state your name.
My name is Paula.
Thank you, Paula.
I'm just but I'm here speaking back to myself.
Sure.
There's a couple of issues I'm going to focus
Paula is not audible.
Oh, I'm sorry.
Okay, so what
We may
we're gonna do, we have here Ms. Johnson, who's a member of the Board of Ed, but she's here as a private citizen. She has some questions. We're gonna try to bring her up here. She's respectfully wearing a mask, even though I know it's not easy for her and we appreciate her. So, can somebody who's on video raise your hand if you can hear her okay?
Okay, thank you very much for letting me speak here tonight. First of all, I think we have we had an executive order 74 back when we had this mask mandate in the city. And I'm trying to pull it up quickly here, but I'm gonna block myself out of my phone. Okay, executive order 74, which exempted people that have disabilities that could not wear masks to go into any place. And if you go back to the executive order, I don't want to spend my whole time on here, and I can't read because my mask is fogging up my glasses. People with disabilities were exempted. Any person who declines to wear a mask or face mask covering because of medical or developmental issues or difficulty breathing shall not be required to produce documentation or other evidence with verifying the condition. That was definitely abused by the city with the mask mandate. The governor exempted it. If you look at this, state reps should know about it. I apologize to people that I didn't realize it. CDC, N95 general mask, surgical masks. These masks are designed and approved for sterile environments. Doesn't help. Surgical cloth masks do not filter anything. As you exhale, you are riding your lungs of contamination and carbon dioxide. Cloth masks trap the carbon dioxide best. It usually risks your health rather than protect it. The moisture put in these masks will become mildew within 30 minutes, dry cough, enhanced allergies, sore throats, and symptoms, micromold in the mask. Okay, parents. Doctors will understand this. Parents took their kids' masks, and what they did was they brought them in, and they found all this bacteria. I mean, I can leave this. Your doctor will understand the bacteria that was in the mask. You know, causes Lyme disease, diphtheria, Legionnaire's disease, severe meningitis, sepsis, and a whole host of tuberculosis, pneumonia. So what we're doing, we're keeping the bacteria in us rather than exhaling it out. So, I mean, and I have more and more studies that I did prior to coming here tonight because I feel very strongly, you know, you could tell people we were all told, take the shot, take the shot, and you're going to get the shot. Now, now you're going to have to do more. Enough is enough. We don't need government to tell us what to do anymore. We want our lives back and we want our freedom without these masks. And I'm sorry, people who have health issues cannot wear masks and they were forced to, and we can't have this happen again. We, the people, have elected everybody, and although you're the Board of Health and you're the commissioners here helping, enough is enough. We cannot do this anymore. Kids are being sickened, and adults are being sickened by these masks. Thank you very much.
This is Dr. Rosenblum. Thank you very much, Ms. Johnson, for coming and sharing your perspective. A couple of things. There's a lot of background noise. If you are not speaking, if you could please take this opportunity to mute and then unmute when you are speaking, when you're called upon by the chair. That would be very respectful to all the people that are trying to listen, especially since, from an audio standpoint, this is not set up as a TV studio. The second thing I will say is that what we intend to do is let people speak. And instead of addressing any particular concerns or questions, then once we have the body of, once we get the flavor of what people are concerned about, we will try to address these things and incorporate them into our messaging. So thank you very much.
I have 3 hands here, and I'm hoping it's left to right. Thank you. So Beth, you are up. Yes, please. I'm sorry.
Yeah.
Please introduce yourself so we know who you are.
Beth Scare, Nashua resident. I just wanted to say, we have a very high, my understanding is we have a very high vaccination rate for the elderly and the chronically ill. And because those are the people we wanted to protect, I know it's not going to be a perfect solution since we have a lot of healthy people who aren't vaccinated, but I hope that now that those people have some measure of protection, that we can keep our freedoms, you know, to go out unmasked and live our lives. We can't go on like this forever with shutdowns and mandatory masks and and we especially should not be putting masks on kids when we know they are very unlikely to pass the virus along, and are very unlikely to get sick. And these kids have suffered a lot. There's a lot of mental illness going on amongst them, and we really need to think of them. And, you know, the elderly and the chronically ill, it's just, we've done our best and we need to go on and live our lives. So I appreciate you listening to me. Thanks.
Thank you, Beth. Lynn? You have to unmute
Hi.
yourself. Hi, Lynn.
Yes.
How are you?
Hi, good. How are you?
Good, thank you. You have the floor. Sure.
So my name is Lynn. I'm an ER and ICU nurse at one of the two community hospitals here in Nashua.
Mm-hmm.
And going on what Beth said, I have seen a fourfold in the number of children who have come into the emergency department for mental health issues, a result of isolation and not being in school. Further than that, though, what's most pressing to me tonight is we hear a lot. We've heard the numbers. I understand that there is a substantial increase in the number of COVID cases. I would like to point out at my own hospital, there are no admissions currently for COVID. And so I guess I would like to say, I would implore upon you to not go back to the mask mandates. I don't think the government should be legislating what we are and are not allowed to do. I think that your messaging would go far further if you could encourage people to mitigate their risks and also protect those who are most compromised. And that is anyone ages 76 and over with diabetes, heart disease, hypertension, that's the trifecta. Diabetes in particular and obesity are the two largest risks. I personally don't know anyone that has had COVID. Being in the ER and ICU and working in this for almost 2 years now, I've never had it, never been tested. That's not to say that the transmission isn't there. I believe that it is. However, I believe that we have to protect those who are most at risk. And I don't believe that we should be masking everyone. I think that it's more important for the city to gain the trust of their residents back by allowing them to make the right choices, and by you guys keep on encouraging vaccines while protecting those most at risk. Thank you.
Thank you, Lynn. Appreciate it. Next, Alicia.
Hello, Alicia Houston.
Hi, Alicia. How are you?
I'm good. How are you?
I'm doing fine.
So
restarting the timer.
Oh, okay. Sorry.
You got
Dr.
it.
Gers Brishton, a London neurologist and neurophysiologist with a PhD in pharmacology, stated in part that prolonged mask wearing for hours will cause irreversible brain damage. This statement was made by a medical professional within her scope of practice. According to a recent Stanford peer-reviewed study on the efficacy of masks, the study determined that the practice of wearing face masks has compromised safety and efficacy. Both medical and non-medical face masks are ineffective to reduce human-to-human transmission. Wearing face masks has adverse physiological and psychological effects. Long-term consequences of wearing face masks on health is detrimental. Under which section of the current budget will the Nashua City be using testing similar to OSHA fitment testing that would need to be done for at or about all of our 90,000 residents. What peer-reviewed medical studies has this Board of Health's recommendations of masks versus no masks in this city? Under which scope of practice does epidemiology fall under a pediatrician, dentist, or a thoracic surgeon? Given that masks and rebreathing of carbon dioxide have been proven to decrease blood oxygen saturation, increase heart rate, decrease cognitive awareness, delay reaction times, and more, which medical professionals will the city of Nashua be implementing when they implement potentially a new mask mandate to monitor the blood oxygen saturations, heart rate, cognitive awareness, and more under each and every Nashua resident? The current Board of Health includes a pediatrician, a dentist, and a thoracic surgeon. Are these three individuals certified in epidemiology, neurophysiology, neuropsychology, or pharmacology? The prior mandate cost our city millions of dollars in lost revenue, and it devastated and in some cases completely eliminated small businesses. If history truly does repeat itself, then this road this Board of Health may potentially be asking us to travel down is a devastating road, and it will impact the Nashua community in a negative light. Thank you.
Thank you, Alyssa. Next up is Allison.
Hi, yes, thank you. Allison Dyer, Wellman Ave. I just would like to echo Miss Lynn's sentiment there about the messaging being really important. She's absolutely correct about comorbidities being a large issue with COVID and suffering more extensively from COVID. And as Stephanie knows, and as Lynn knows, currently our hospitals, we're not overrun with COVID patients. This was 15 days to slow the spread, not overwhelm the hospital systems. And we've done a really good job with that. I think total at Southern New Hampshire Hospital right now, there's 85 patients and 5 are COVID positive. None are currently in the ICU, which is great. And also, you know, now with COVID, it's clearly a disease. We have treatments that are available. It's, you know, become increasingly clear, even with the variants, that the statistics indicate that the steps taken to combat the original spread of COVID has kind of been disproportional to the harmful and the relative to what the disease has shown itself to be, as evident at the various levels, including, but not limited to, like the previous caller, Ms. Alicia, stated, you know, physiological, psychological, social levels, the arguments to utilize this all for the common good to justify the various mandates imposed on people kind of ignore the reality of the significant long-term and potentially multi-generational negative consequences with all the information that we have to date. So I would just implore this board, the city of Nashua as a whole, to, again, with history as a good, you know, predictor of future, to just allow the citizens to be the citizens. We're at over half vaccinated, and keep pushing the messaging to be healthy and, you know, just vaccines work. We know this, and moving forward, we didn't appoint or elect the CDC, and we'd really like to just continue on trying to be a healthy city and society and see everybody's faces. So thank you.
Thank you, Allison. Next up, Christopher.
Hello, everyone. I'll try and be brief. I think pretty much everyone here probably knows my opinions on a lot of these things. One of the I don't have any concern with this conversation over trying to continue to educate people, although I'll be honest, I don't think a year and a half plus in that there is anybody in the state of New Hampshire that is not already educated or looking to educate themselves further. There seems to be this attitude from everyone in the government, from the Board of Health lately, that almost that we the people are completely incapable of making decisions for ourselves, and that we're not capable of finding information and further education. So that's a little irritating, and I may be the only one feeling that way, but thought I would mention that. Another issue I have is with the statistics. if we are going to continue to educate people, there are some missing statistics I would really like to see, and I would love an answer from anyone on the Board of Health here that could tell me what is our capacity for COVID cases, because 15 days to slow the spread was based on our capacity. And never once have I heard a single individual give a statistic saying we are at 32%, we're at 12%, we're at 20% of our hospital's capacity to manage these cases. Because that's where the true fear is to overrun our medical workers. Nobody wants to talk about this. Everyone wants to talk about COVID cases and not define what a COVID case is, right? A case is a positive test, correct? So if somebody tests positive, asymptomatic, could be a false positive. Another statistic nobody wants to bring up to say, oh, well, actually, X amount of the positives are false. Therefore, let's adjust these numbers to account for that. People don't seem to like to do that. They like the bigger, scarier number. If we're going to educate people, we need to get real with our statistics and stop trying to scare people, because that's what's scaring people away, is everyone's fear mongering and no one wants to hear it anymore. That's all I have.
Thanks, Christopher. I do not see any other hands up. Yes, I do. George.
Hi, Tony. Can you hear me?
Yes, George, go ahead.
Okay. Quick question, or two questions actually. One is, what's the expectation that there might be a mask mandate or will be a mask mandate? And then what wording is the city prepared to use? Are they encouraging them? Are they recommending them? What is there a terminology that the Board of Health or that the health department's going to let people know what their recommendation is in terms of masks?
Okay. Actually, Dr. Stephanie wanted us to go through everything and then kind of answer, but I'm going to jump over her on this one, if that's okay with you, Stephanie. Thank you. We're not looking for a mask mandate. Not at this point in time. Again, I keep coming back to this. When we took the mask off back in March, I said the variants were going to be the wild card, that we don't know what's going on. So what we're really doing is trying to go to the citizens, get their feeling for what's there, and see if we can find a common thread that we can educate. When we talk about education, education doesn't stop the day you walk out of high school. If it does, the world is passing you by. So what happens is you continue your education, whether it's self-taught or whether you take online courses, or go back to college, whatever it is. And that's our job. Our job in the public health sector is to try to prevent disease and to educate the public. And so what we really want to do is we want to educate people to let them know we've let our guard down, because things have been really good. But this time, we don't want to get caught with our guard down. Things are happening. So the way I envision this, it hasn't been voted on, it hasn't been discussed yet, but the way I envision this is making recommendations to people to sound the alarm that COVID Part 2 is now here. And the best thing that we can do is continue to get people vaccinated. We know historically, when we vaccinate, the first 50% is easy. The second 50% is really where you have to work hard to get people to do that. So that's our job. We need to go out there and knock on doors and do what we do best through the Department of Public Health. But we also need to tell people, look, this stuff spreads, and we all know it spreads from one person's nasal or mouth excretions to another person. So we would like people to be aware of that, and if they're going into a crowded place, they need to protect themselves. And being vaccinated no longer is the, I don't know what you want to call it, the golden thing that is going to protect everybody. We know because of these breakthroughs that you have to protect yourself in those environments. And I think that's, again, part of the education process. No mandate, that we're not looking for a mandate. We're really looking for everybody to stand up and do their part to protect themselves and to protect other people. We're not in this by ourselves. We're in this with other people. Wearing masks makes sense. Let me tell you, I've been wearing masks for over 40 years. Some people may say I'm brain dead, but I'm not, okay? And you know, George, if I walked in the room and I didn't have my mask on and I didn't have gloves, and would you let me work on you? No. Okay. So masks do work. Do we know everything about masks? Probably not, because we keep learning. There was a time when the Earth was the center of the universe. Okay, everybody talks about science. Guess what? Galileo proved it was different. Every time we think we learned something in science, there's always somebody that tweaks it and moves forward. So we really want to protect our citizens. We do not want you. We do not want you to die. We do not want you to have long-term disability with something. Okay, so that's really where we're coming from. The doctors have to talk it through and what have you. But I would not be in favor of a mandate at this point in time. However, if things change, things change, and that's what you pay us the big bucks for, right? I wish, but we're here to help protect. We're not here to take freedoms or liberties. We're here as people in your community that are here to help you and to keep you healthy.
Okay.
Did that answer it, or did that sound?
Yep.
Too...
That's great, Tony.
Okay, thank you, Joe.
Thanks.
Any other hands? More than willing to list up. I think we have some.
Lori Ortolano.
Some people asked questions and didn't lower their hand. So if people that have already spoken could go back to that icon and lower their hand so we don't get confused.
Yeah.
Unless you have a request to speak.
Second question, yeah. I have Diana.
Yes, thank you.
Thank you. Go ahead, Diana.
I'm hoping that you answer some of the questions because there's been some pretty valid questions asked. From what I heard, there's 35 people that are hospitalized. I'd like to know, of those 35, how many were vaccinated? How many are there as a prophylactic? Because you can't go to your doctor, you have to go to the hospital. Versus how many are in ICU? I don't believe there's any. You stated that the masks do work. However, there was a lady on here telling you there's peer-reviewed from Stanford and so on that say masks do not work. So, and I'm understanding your bias, but just because you say that doesn't make it true. She's asking you, where are your peer-reviewed studies that you're pulling this information and educating the public with? That's what we need to know. Thank you.
Okay, thank you. Lori.
Hi, can you hear me?
Yes, ma'am.
Let me open my little, okay, hi.
Hi.
Good evening. I enjoyed listening to your communications that you offered to us. I think the enhanced messaging or continuing messaging is important. I think, my observation going around Nashua is you still see many people wearing, take the precaution and continue to do so. So, I think that making people understand that we still need to be vigilant, but allowing choice is important to me. Schools are an issue for me. I really hate to see the kids have to go back into school being fully masked all day long. I do think it's a hindrance for kids, and I'm not sure that the data is there. I guess what I'm most interested in is understanding what the hospitalization rate is for children and the failure to recover, because it seems to me that the kids rebound pretty well. And I know it could spread rapidly, but they, to me, are not the high group for hospitalization or loss of life. And so I just, the other thing is at the beginning, when all the statistics are read, it's hard to follow that. It would almost be nice to have a chart and maybe consolidate that statistical information a little differently, kind of show us where we were in the beginning of this pandemic and what we see now. I mean, when I think back to the beginning of the pandemic and medical treatments, we were throwing everyone on a ventilator, which was really the kiss of death there. It was bad. And a lot of people died, I feel almost needlessly, by using ventilators too extensively because we didn't know how to treat it or we weren't exactly certain what to do. So But I do think the messaging and, I know I make my choices to go certain places, not eat out often, limit my group activity, because I choose to do that. And I think for me, it's wise to do that. But I really think people should have a choice. And I want to switch just for a second to the change that's being proposed for your board to go to a 5-person board. I spoke up and I've listened to all the discussion, and I am not in favor of that. I think you should remain a 3-person board. I don't think the justification to change it is really there or was there. I feel that the Board of Assessors is a 3-member board, and an option for you out of concern that you might not have a quorum would be to do what the mayor does with the Board of Assessors, which is they have an appointed alternate, and their charge is such that the alternate is there on deck if the 3rd person can't be present. But I will tell you, the mayor has not filled the alternate position in over 3 years, so they don't think it's important enough to have the alternate. And I can also tell you that the Board of Assessors has run as a 2-person board for 5 or 6 months before they even put a replacement on. So I also want to let you know that I thought that both communications times that you came forward and presented to the committee, you were very articulate and passionate about why this, you wanted to keep this board nimble and, connected and productive. And I like that communication. There's a lot of merit in that. I think that, I think that I was very disappointed when I watched the committee meeting on Monday night that we've had well over 2 hours of discussion on this 5-person board, and the committee responsible for making recommendations to the full board could not make a recommendation and did not. They passed it off without anything. I was very disappointed for you to hear that. I'm very disappointed for me to hear that, because I've listened for 2.5 hours. And I feel next Tuesday, when it goes before the full board, you are going to be left to say many of the same things again. And we're going to be left to listen to the same story that has been replayed in the same track and groove 3 times. And I think that the committee owed you a vote on how those 5 members felt. And now we have to play it out again. So I just want you to know that I support this 3-person board. I think you're very productive. You do what needs to be done, and there's no need for a charter change and expansion on that. Thank you.
You're muted.
Oop, I'm muted. Can you hear me now?
Yes.
Oh, sorry. Sorry very much. I'm sorry about that. I just wanted to thank Lori for her questions. And I am sorry we do not have any charts. This was an emergency meeting that we called because of the changes that we saw. So we didn't have time to do those nice fancy colored charts and what have you. But I do respect the fact that you want to see the data, et cetera. And I want to thank Lori for her statement supporting the board as is. Tom, you're up. Alderman Lopez.
Thanks. On the issue of masking ordinance or public health in general, I want to thank the Board of Public Health for all of the guidance that has gotten us through the epidemic so far. I think we do know a lot more about COVID-19 than we did this time last year. And that's why it's important for the public to be reminded that it's urgent, that there is new variants that are spreading, and to have the specific nature of those concerns be articulated by the Board of Health. I think this is a very transparent step where we're having the initial conversations and acknowledging that risk is being raised. And I think that's appropriate for the Board of Health to be doing at this time, with the effort to educate and raise awareness and still put faith in the public that it can mitigate its risk, it can manage its behaviors. I am pessimistic about those because, as was stated by a previous speaker, there isn't anybody in New Hampshire at this point who doesn't know about COVID-19 or what it is. And the circumstances that we're in today are because it's continuing to spread and because it's being spread by people who are unvaccinated and they're the hardest hit, it's presenting an increased amount in the community. And so now we have to have this discussion. We got to 53% vaccination, not 100%, not even close to 100%. And I think that the public health department worked night and day for months trying to organize and run vaccination clinics and recruit people to come and make sure the public knew how to get to them. And all of that work, I think, has saved a lot of lives and has made Nashua a healthier place. I do think it's disingenuous for people who have opposed all of the mitigation measures to date, unequivocally, to now say that we should continue those mitigation measures instead of addressing the current situation. But I also think it's the Board of Health's role, per our city charter, to make recommendations to examine this issue. And I will support whatever recommendations they make at the Board of Aldermen if legislation is necessary. But I do think the public should be focusing right now on reducing the spread, harm reduction, doing whatever you can to make sure that you're making safe decisions for yourself and your family. And that's a preferable approach to any kind of increased regulations, guidelines, or any other measures. Thank you.
Thank you, Alderman Lopez. Beth, you are the next batter up.
Yeah, I wanted to follow up on Dr. Rosenblum mentioned the childhood vaccinations, and I wanted to say that the COVID vaccine isn't going to be as important as these other childhood vaccinations because the kids don't get sick. And I hope there isn't a lot of pressure on the parents to get their kids vaccinated. I hope they feel that, to take their own kids' health into consideration, because it's not like the other vaccinations. They're not going to, very, very, very few kids have become seriously ill or died from COVID. So I just wanted to mention that. Thank you.
Thank you, Beth. Is there any other questions out there? I'm not seeing any hands. I want to make sure that we get everybody and everybody feels they were addressed properly. I don't see any. Would you like to? There was a lot of questions. I thank you for the questions. A lot of them are in depth. Some of them we won't be able to answer because you asked for peer review material, and I don't have any peer review material here because that wasn't my idea to bring tonight. My thing was to get in here and let's start the conversation and listen to you, and hopefully having you listen to us and maybe have us formulate some questions as well. So that's saying what I'd like to do is people mute. Can everybody mute, please? Yeah, Tom?
I think Tom is outside wanting to come in. If I could just talk, because I brought his phone.
Okay.
But we are hearing.
All right, thank you, Tom. I appreciate that.
We do hear some background noises, and I can see probably half a dozen screens that are not muted. So I'm going to do my best to project through my mask, and if you could mute, that would be really helpful. So really appreciate people taking time out of their busy schedules to provide us with their perspectives. And I'm going to do my best. I have 4 pages of notes here, and I'm going to do my best to address all of these questions. I have 3 minutes. Thank you, Dr. Storis. I don't think I can do it. Okay. So what I would say is I will do my best to, Bobby, where are these from? What this is? New Hampshire. Okay. I might call you in on that. I'm going to do my best to address the questions. And then with Dr. Storis' permission, we'll see if people have follow-up questions or if I forgot something. So I tried to number things. Okay. First of all, to be clear, we are not elected. We are appointed. Secondly, we are only in an advisory role, as Alderman Lopez referred to. So we don't make any mandates, we don't make any ordinances, we don't make any legislation, we're here to advise. And I, Dr. Stephanie Wolf Rosenblum, am board certified in internal medicine, pulmonary medicine, critical care medicine, and sleep medicine, but I am not a thoracic surgeon. So I just want to be cleared. But I have had the privilege and the perspective of having treated many people on ventilators and ICUs, and unfortunately seeing many people die of infectious diseases over the course of my career. So the second thing I want to say is that it really pains me to think that people are perceiving our emergency meeting tonight as providing information that people should already reasonably have, and that people are not capable of researching information. That is not at all the way we feel. But what I will tell you is that within the last 48 hours, I have spoken personally to people, CEOs of companies, attorneys, other physicians, all of whom have questions because, as I mentioned before, this Delta variant is a game changer. And I would be surprised if there aren't at least a few people that are on the Zoom right now that have not heard about the Lambda variant. So the data is changing every day. It's hard for physicians to keep up. And so it isn't a matter of us trying to confuse people or insult them by saying they don't have information. But unless you have all day and all night and medical knowledge and, you know, the capacity to view all the different medical journals and all the different departments of health and track what's going on, not only in New Hampshire, but in New England and the whole United States and the world, very hard to gain a perspective of what we're trying to do. We are trying to get ahead of the curve because what we see in places like Arkansas and Louisiana is they are running out of beds. And last year, we came very close to running out of beds. However, when you say what's the capacity, what we did last year when we had so many sick people and we had no treatment, there are still very few, and we didn't know what to do with the ventilators versus other methods of rescuing people from respiratory failure. We had Plan B, and Plan B is we canceled elective surgeries and we set up field hospitals. I have a personal friend whose knee surgery, and I don't want to make light of anything or equate one thing with the other, but their knee surgery was delayed almost 6 months. They were in excruciating pain because they weren't doing elective procedures. So the capacity in the hospitals is tracked daily. There are, depending on the level of COVID, because it's an over and above what we're used to. We track beds, we track ICU beds, we say, when do we need to start planning to, stand up more beds? When do we need to start thinking about canceling elective surgeries? In the United States and around the world, the medical establishment is terrified of what's going to come next, not from the COVID, but how many cancers did we miss because people's mammographies and CAT scans annual checkups were delayed. There was a drop in heart attacks, but there was an increase in death. How many people who had indigestion or chest pain didn't go to an emergency room because they were terrified of getting exposed or being admitted or whatever? So there's a tremendous amount of downstream that is not just about the COVID. So I thought it was important to mention that. There is a lot of misinformation, and what is happening, not just with COVID, but with a lot of other medical conditions, is that you can usually find an article or a study to support various views. And what we do is we study the literature that is juried literature. So we study literature that are in the peer review articles. And there is a controversy right now in the medical profession about articles that are coming out that haven't gone through the normal vetting process. of people looking at the statistics and where did you get those statistics. And you can't compare statistics from last year with this year or even 2 months ago, because this Delta variant is, as I said, a game changer. I want to talk about kids. So right now in the state of New Hampshire, there are, is this right now or for the year? Okay, so since we started this journey, there have been 5,817 cases in children between 0 and 9 years old, and 12,692 cases in children between 10 and 19, and about a little more than a dozen in each age group are hospitalized. In the United States, there is 4,196 children have developed what's called the multi-organ system inflammatory disease, and 37 of those have died. This is a reaction that children have to COVID, where they get inflammation of the heart, inflammation of the brain, total body failure, and with devastating consequences. About 50%, the median age of those children with multi-system inflammatory disorder is 9 years of age. 50% of them between 5 and 13, and very disturbingly, 62% of those with the MISC were either Hispanic, Latino, or Black non-Hispanic. And we don't know why. We don't know if it's some genetic predisposition. We don't know if it's, we just don't know. COVID vaccines for kids will be very important to prevent illness, long haul, and death. Because there have been the statistics, excuse me while I shuffle my papers and my whatnots, as I try to answer in real time, is in the United States, there have been 337 children under the age of 18 that have died of COVID, 2,470 between 18 and 29 years, and over 7,000 between 30 and 39 years, 18,000 between 40 and 49 years. So I know that a lot of people are talking about the fact that the disease is one of, old people over 76 or with terrible illness, but it's not. And what they're finding with the Delta variant is it's as transmissible as chickenpox. Very few people die of chickenpox, but we do vaccinate kids because it can have significant consequences, and it can scar the lungs and so forth. Bobby tells me that we in Nashua have investigated 2 cases of MISC, that multi-organ system, inflammation in children, both thankfully survived. So, this is the information we have today with the Delta variant as to how infectious it is and how dangerous it is. But we are worried that it will become more and more infectious. And as the community, the older community becomes vaccinated, then the people most at risk are those that are unvaccinated. Someone said, and again, I'm shuffling my 14 pages here, that we've done the best we can do. And I would say from where I sit, we have not. In order for us to really protect the community, we need 70 or 80% of people at a minimum to be fully vaccinated. And those are statistics that come from general infectious disease principles, which, physicians who treat pneumonia and people in the ICU and such, Dr. Paquetta as a pediatrician, are familiar with. When we originally encountered the COVID-19, we were worried about the Middle East respiratory syndrome, which is a related disease that had 30% mortality. Hopefully, we're not going to get there with the variants, but we just don't know. I'd next like to mention that for a lot of people, they've been concerned about the vaccine that had emergency use authorization. And there were a lot of concerns about how fast the vaccine was coming online and that we didn't have an opportunity to monitor it for more than a couple of months in a limited number of people in a limited number of circumstances. But it is anticipated that the FDA will approve the vaccine sometime in the next 4 to 6 weeks for full approval. And I think that will make a difference to some people, that they will feel that if we're 18 months in and we have, a good year's worth of data from not just the United States, but other countries that have vaccinated, that people may have an increased level of comfort with taking the vaccine. And as far as the third shot, which some people have mentioned, we don't know the timing of a third shot. It is not approved yet in the United States. But because this virus mutates, just like the flu virus did, it is entirely possible and indeed likely that this will be something where we take an annual vaccine and they may be able to design the vaccine to address the specific changes, the specific mutations, and hopefully it's not going to continue to get too far ahead of us. I also want to mention that, okay, I'm trying to shuffle all my papers. Let's get to the mask. So Dr. Storrs used his famous sense of humor about masks. But physicians have been wearing masks for hours on end in operating rooms, in ICUs, and fit testing is not recommended for the N95, but there is no question, based on the literature, that masks do prevent transmission and they do prevent illness. It is part of the Swiss cheese model that I said before. It's masks alone are not enough.
Oh,
but
that's
they
that
are,
missing piece. Let me see that.
excuse me, if we could mute, please.
That's a missing piece from the puzzle.
So thank you. So it speaks to the level of concern about how many people thought we were coming here to talk about mask mandates. We weren't. However, I am concerned about some misinformation about masks. There are scientific studies that show that the level of CO2, even with exercise, that is not a concern for the majority of people. And for people who have medical conditions that would put them at increased risk of getting COVID, of being extraordinarily sick from COVID, of being hospitalized and dying from COVID, those are the people that need to protect themselves. And if they cannot wear masks after conferring with their physician, I recommend all my pulmonary patients wear masks. And, with rare exception, they probably shouldn't be in places where people are unmasked or they're in crowds where they can't socially distance. I would say even in outdoor settings with what we know about the Delta. So I don't want people to walk away with the idea that masks are harmful in a way that should prevent people from using them as one of the tools, as one of the barriers, as one of the things we have to fight the COVID. Last year we had the misperception that if we masked until we got vaccinated, this would go away. It's not going to go away. We're probably in this for the long haul. So people will need to make decisions about what level of risk they're willing to accept. And so what we want is we're not able to use the chat. I know people are kind of asking questions on chat. We're not able to use the chat in this emergency meeting. But what I would tell you is that, yes, for many people, there are psychological barriers to wearing a mask. And when you talk about communication, we talk about the fact that the words are 10%, the tone of 30%, and the body language, which includes facial expressions, is 60% of communication. So we lose some measure of communication. We have to work harder to communicate when we wear masks. That's what I put. But one must weigh that against the psychological effects of having someone in your family die, of losing a parent, of losing a grandparent, of losing a child. And if it's not death, of people being so disabled that they're unable to care for their children, unable to work, unable to keep a roof over their family's heads because their whole world has been turned upside down. Everything in life is a risk-benefit calculation. And what we're here to do tonight is to help you think about what level of risk you're willing to accept, and to help you, if not take messages away from tonight, to understand that one needs to keep informing themselves. One needs to keep, very close to the data and the things that we will publish, that we will share. Was there anything else that I missed, Tony?
Exactly.
That was not 3 minutes. Yes. Yes. Yeah. Yes.
Right.
Yeah.
Right.
Yeah. So just to answer that, thank you so much, Bobby. To me, encourage means, it's probably a good idea, and if it's not a very taxing for you, then do it. I think recommend is more strong. And I would also add that people around the world have, ever since MERS, the Middle East syndrome, and the SARS that was in China and the East, you see people in Far East countries wearing masks all the time. It's just part of the culture. And what I would say is, we are here tonight to make a recommendation that each person use a mask. Not recommending a mask mandate, but we strongly recommend using a mask and becoming vaccinated to protect yourself, your loved ones, and our community. Thank you so much.
Hello, everybody. So I hope we've answered some questions. I do see 2 hands up, and I'm not sure if that's residual from before, but I really feel that it's important that the population, the citizens, have a say, and I'm interested in what they're saying. So Lynn just dropped out, but Alderman Lopez, you want to talk, or is it just we didn't clear you? I think it's our problem. I think we failed to clear him. Oh.
Yeah, I thought my hand was down. Sorry about that.
No problem. Go ahead, Tom.
No, I don't have anything new to say.
Oh,
But thank
okay,
you.
I'm
I
sorry.
love talking. Okay, I'll stop.
I misunderstood. I'm sorry. So I hope that the message that came across from us is that we really care about you. We really care about our city. We don't want more statistics. Things are changing. Like I said, it was more frustrating before because this was brand new. Nobody knew about it. Nobody knew what to do. Conflicting opinions left and right from very, very seasoned professionals. And everybody thought they were correct. And some were a little bit, and some were a little bit more, and some were not at all. So you have to understand, we're trying to do the best that we can, but we need your help. That's the important. That's the thing I want to come across here. It's not us. It's not anybody saying do this, this, and this. It's you, the general public, doing what's right for your community and helping us keep those statistics down. I personally have lost 3 people with COVID at the beginning. So I understand. It's an emotional thing. What I'd like to propose is the Board of Health recommends the Department of Public Health to increase their messaging to the citizens of Nashville to practice preventive measures, including vaccinations, social distancing, and the wearing of masks in crowded situations. You have to make that decision. No one can dictate that. Okay, so this is not a power thing. I just want you to be safe and healthy and have a great life. Somebody have a question?
So there's one other thing that I wanted to talk about, which, I'm gonna, no, thank you so much, Alderman Cleve, for always being at our meetings and asking important questions.
The reason why I didn't want to be.
So we're trying to understand the immunity and how long the immunity lasts. One of the things that is unknown is how long the immunity lasts from having had COVID and how long the immunity lasts from having had the vaccine. However, there are data from several areas, including several other countries, that show that it appears that immunity does wane with time. Like the flu, where we say the vaccines are especially active for about 6 months, and then by a year later, it's not that helpful. So it depends on how severe infection you had. One of the things that is again, a wild card is the Delta variant. Initially, what is really remarkable about the science is that the COVID spikes that make it called the coronavirus or crown virus have 2 different forms. One is a sort of an enveloped on itself form, and the other is like an open umbrella, and that's when it attaches. And it's a little harder for the antibodies to catch the virus when it's in its curled on itself hiding. And some of the vaccines were able to open it up so that the material that was seen by the body and that was reacted to was the open form, which is easier to recognize. And so that was what was making the vaccine so effective. But now with the Delta variant, it has different, folding and configuration. So the short answer is we don't know, but we do know that immunity wanes, and we do know that even if you've had COVID, that you get a significant boost in your immunity from getting the vaccine. And so it is recommended that people who have had COVID do receive the vaccine for their own protection so they don't have to go through that again.
Any other questions? Susan Mack, is that the one?
Yeah.
Susan, I don't see you as a little square, but something on the side here. Just believe me, this is not my day job. So if you'd like to speak, you have the floor. Okay, maybe that's the case. Is there anybody else who would like to speak or have any other questions?
Susan put a question in the chat.
Yeah. I'm sorry. I don't know how to. If it's not a square, there's nothing I can do. I guess what she's looking for, Stephanie, is to address immunity from having the COVID, but I don't know if that's answering what she wants or not, and I'm not even sure she's on. So.
I thought
I thought you did.
And we said we were going to do a chat, but that came to me from another source besides the chat.
I hope you found this informative. I hope you understand from our point of view what we're trying to do, from your public health point of view. And I actually kind of like this, not that I feel comfortable talking to a computer screen, but maybe in the future we'll have more of these chats and not under duress with the disease process. But I want you to know there is no mandates. If somebody says the city's mandating, or I can't tell you what they're doing in Concord, but there is no mandate. We're just asking you to realize you dropped your guard down. Don't do that, because we found out in a bad way what happened in Providencetown. People that had vaccines still came down with COVID. And because we know this is so highly infectious, and the fact that there's the viral load, how much virus is in the nasal pharynx, and the fact that one person can infect up to 8 people, you can see how exponentially this thing can just take off on us. And I think if we wear the mask and be vigilant, we can at least shortcut it, and hopefully it'll die out, or hopefully we'll figure out, some other way of taking care of it. But this is an ongoing thing, guys.
So I was so busy trying to look at all my notes and answer the questions that were raised, which was an important part of this, that I want to suggest something else to all those listening. When we talk about public health and we talk about safety, we say, have a plan. Have a plan for when the power goes out, as it does when we have hurricanes and snowstorms. We say, have a family plan. If, God forbid, there's a fire in your home, how are you getting out? Where are you meeting? I would suggest that every person, independent of what their decisions are regarding the vaccine and masking and what you've heard tonight, and hopefully we've inspired you to learn more about certain aspects that might affect you in your family and stuff. If you become symptomatic, if you have any of the listed symptoms of loss of smell or taste, respiratory symptoms, diarrhea, GI symptoms, don't assume that it's not COVID because you don't know of a definitive exposure, because you've been vaccinated, because you've only been to the supermarket. Please have a plan for yourself and your family, what to do if you become ill, how to get tested, where to get tested, what to do if you're exposed. Maintain an awareness of what's on the CDC guidelines and the New Hampshire Department of Health and Human Services. For those of you who run businesses, who are community leaders responsible for others and for programming, have a plan. Have a plan for today. Have a plan for tomorrow if our ICUs fill up, if our statistics continue to go up, for a graded plan of requiring masking, if that's, what you think is going to protect the people that are expecting you to provide them with safe environments. Have a plan. And that plan would not be to just rely on the vaccination or just on masking, but to have that comprehensive plan to prevent the Swiss cheese of the virus getting through. Thank you so much.
Thank you, everybody. The other thing that I would mention, I just thought of it because Stephanie said something, is you have a great public health department here in the city. There is plenty of information on the website, and these groups of really dedicated individuals, if you have a question, you could call them up. I know they're super busy, but the thing of it is they're here to help you. They really are. It's not a job for them. It's something way past that. And I'm telling you, healthcare providers are not in it for the money. They really want to help people. And that's what these are. We have immunization clinics from 9 to 12 on Friday. And we have a bunch of things. I want you to, I really, instead of dictating to you what we do, I want you to go on the website and explore and see what's there. And if you are interested, if you think that these, I know we're doing this specifically because we're all nervous about what's going on, but if you think you want to hear of other things in the future, please write to the Department of Health and we'll see if we can do something to do that. Yeah, and we do have a newsletter too. So, I mean, we really try. Thank you for your time, your questions, your concerns. I wish you all a really great rest of the summer. Hopefully we'll get out of this fall weather and maybe not rainy and we can enjoy it. But stay healthy, stay strong, and have fun out there. Bye now.